Hello, everyone. Thank you so much for joining us this evening. My name's Dr. Bielfield, and I'm at Southwest Parkway office, part of Westlake Dermatology. And I'm super excited to talk to you about Ultherapy. It's actually one of my favorite treatments. I think it's a really good product and treatment. And I wanted to thank you for your time today. The presentation is going to be very concise and short so that you can make the most out of this and ask questions afterwards. If you have questions, you can just push them into the Q&A button at the bottom of your panel, and I'll be happy to address any of those afterwards. So with that, we'll go ahead and get started. And so Ultherapy is all about tightening the skin, and it's an option for something other than surgery. So as we age, the volume loss occurs from our face, really on the mid-face, which is around the cheek area here, and works its way down. And we see that in many ways that we all sort of notice, whether that's lines and wrinkles or hooding of the eyelids or sagging of the mid-face or neck and jaw formation in the jawline. And that is all areas that the Ultherapy can address for you. I think this is a good demonstration of noting what are your options when you're looking at tightening of the skin or lifting of the skin with compared to surgery. And so this diagram is really showing if you were to have a facelift, the reason it works so well is it works all the way from the top of the skin here, all the way down into the muscle and the connective tissue on top of the muscle. Whereas lasers and radio frequency devices are not going to be able to penetrate as deeply as that, and therefore not going to give you as dramatic a result. However, Ultherapy is something in some ways that can mimic hitting all of those layers from the top layer of the skin all the way down to the muscle and the connective tissue on top. And it has modalities to hit both superficially on the surface near the skin and closer to the muscle. So what does Ultherapy actually look like when you're having it? It's truly an ultrasound device. It is similar to a pregnant patient that needs an ultrasound of their abdomen or somebody that needs an ultrasound for a medical diagnosis. So it's using ultrasound waves, and it's actually showing us live an image as we do the procedure of the different layers of your skin and down to the muscle. And the reason that's important is everybody's anatomy, their skin and their muscle layers, the depth of those and the thickness is different. We're all unique people. And so Ultherapy allows us to actually visualize that and then tailor the ultrasound waves to the specific areas that we want to hit. In this case, we want to hit very superficial under the skin, and we want to hit right above the muscle, the connective tissue, the fibrous layer there. And by hitting both of those, we're going to stimulate collagen and get the end result that we want. I think it's really helpful just to see, well, what does it actually look like when you have Ultherapy? And of course, everybody's unique and different how they're going to respond, but I think that everybody's going to see improvement. And I think these are great examples here of somebody on the top who's a little bit younger and doesn't really have as much laxity, or notice you look at this patient and say, well, do they even really need this procedure? But if you look at the after and the before, you can see the contour on the jawline coming down, and it really helps lift up this area here and even a little bit under the chin. And so it just gives her a more chiseled, more defined look. And then we have a patient who's a little bit older and has more tissue loss and volume loss. And she had several treatments, but a really remarkable improvement without any surgery, any invasive treatments, simply the ultrasound waves stimulating the collagen. And again, same areas were targeted along the jaw area here. You can see a well-defined jawline, and the neck is significantly less lax. This is a patient that we actually had in our office. She did very well with one treatment. Same type thing as that previous younger patient. She was really overall pretty good volume and not too much laxity, but she had a little bit of jaw sagging down here by the chin. And this is approximately 3 months later, so much better definition and really almost no sagging in this area at all. Ultherapy is not just for the midface or the neck. You can also do the eyelids, otherwise known as like the crow's feet, lifting of the eyebrows, and an area here called the décolletage. So the décolletage is essentially just kind of like the upper chest and neck area, and oftentimes, especially in females, we'll see noticeable skin textural changes, crepiness, skin laxity, and it's very common because you're getting a lot of sun exposure in those areas. So your skin is really being punished heavily on a daily basis. And so Ultherapy, you can see left is before, right is after in each of these examples. It really does make a big difference, especially if you're wearing a low-cut shirt or dress. The aesthetic appearance of the chest can really freshen up your look. Here are some examples physically of under the chin or the neck. And again, a very commonplace as we age. The laxity and volume loss is very evident, and it's very bothersome to a lot of people. And so again, looking at the before and afters here, before is on the left and after is on the right, you're noticing just much better textural change, tone, less crepiness, less definition of these what we call platysmal muscle bands, these little kind of string muscles here, all significantly improved in all of these cases. Also can be used under the chin, a very common troublesome place for a lot of us. From the side profile is probably the best way to see that. Again, looking at before on the left and after on the right, significant improvement and building collagen to remove a lot of that laxity. So overall, Ultherapy is a very safe procedure because it's an ultrasound wave. There's no surgical procedure. There's no cutting. There are a few indications where you would probably not be a candidate, and those would be not many, but if you have any electrical implants such as a heart pacemaker or any sort of electrical implants in your body or in your face, probably not the best procedure for you. If you have breast implants, we wouldn't want to do that directly over your chest area. Certainly if you have any active infections or rashes, we'd probably not want to do the treatment. Blood thinners is a relative contraindication. It would just depend on the patient. So in summary, Ultherapy is again, one of my favorite procedures just because you can see from the pictures. It's just a really impressive result with minimal invasion. And we'll go through the process of what that looks like, actually having the procedure. But again, the areas that you can do it on include the brow area, and that would be helpful for raising your eyebrows if they're kind of drooping. This is extremely popular, the mid-face or the jawline to define this area, and then the contour around your neck, and of course anywhere under the chin or neck. And it's not uncommon for somebody to have concerns in all of these areas, and we actually can treat all of those areas at once. And then finally, the décolletage or chest area is another popular area. In general, another question people are going to have is, well, how long until I actually see results? And typically it's going to be somewhere between 3 and 6 months. So, and the reason that is because the ultrasound is actually building the building blocks of your skin that are creating the laxity in the first place. So we all lose elastin and collagen, which are the structural building blocks to maintain the tightness of our skin. And the ultrasound is stimulating collagen formation, allowing that skin to tighten up. So what does the actual process of Ultherapy look like? First thing you want to do is just kind of verify, hey, do I have any of these concerns that maybe this wouldn't be the best thing for me? And again, these are limited to somebody who has permanent facial implants or some sort of electrical implant in your body. Blood thinners, again, it's a relative thing. It depends on what you're on and your other medications, and then also planning of this. So if you're hoping to get results for a special event or a wedding, you want to give yourself a minimum of 3 and even up to 6 months to get those final results. The next question is, how uncomfortable is it? And I would say everybody's a little bit different in their tolerance of procedures, but overall, I think it's a very tolerable procedure. For all of our patients, we offer topical numbing, in which we will put topical numbing cream on your skin on the affected areas for about an hour. And then we also include something called Pronox, which is something you may have been familiar with in other procedures or with the dentist. It's essentially just a tube that you breathe out of and gives you nitrous oxide, or essentially laughing gas. It makes you more relaxed and able to tolerate the procedure. As far as timing of the procedure, how long it takes, it really just depends on the areas involved. If you're doing essentially the whole face, you're looking at about a 2 to 2.5 hour time frame. The nice thing is, again, because it's not a surgical procedure, if you need to take a break or go to the bathroom or just have a snack, that's not an issue. You can certainly take a break and do that. I do recommend, if you're going to have the procedure, you have a driver available, just because of having that Pronox. You want to make sure that you feel safe driving home. And then as far as aftercare, there really is no significant aftercare, other than I do recommend you don't do any strenuous exercise for 1 to 2 days afterwards, just in case there's a little bit of swelling. We don't want to aggravate that inflammation. With that being said, I want to introduce my best friend and dog, Noshi. He thinks he's quite handsome with his wrinkles, but he wants to let you know, if you are bothered by yours, you certainly can do Ultherapy. I also wanted to leave this up here while I'm answering questions. This is where I'm at, Westlake Dermatology. I'm at the Southwest Parkway office, and the best way to identify it is it's next to Carve Restaurant. And this is our office number. If you are interested in actually proceeding with Ultherapy, if you think it's something you'd like to go forward with, we normally have a consultation, but if you feel comfortable, we can go ahead and just book you an appointment, and you would just call our office tomorrow morning and we could get that scheduled. Our website, I have my biography on there as well if you want more information on my background, which is westlakedermatology.com. We also have a scheduling email, which I don't have on here, but I'm going to read to you all. It's appointments@westlakedermatology.com. So again, it's just the word appointments and then @westlakedermatology.com, and you can just mention that you'd like Ultherapy with myself, Dr. Bielfield. We will offer the 20% discount for you. If you want to do a consultation, you feel like I need to learn more about this and really feel comfortable that it's for me, happy to do that, and I will offer you a complimentary consultation for that to ensure it's the right fit for you. Another point is, if you want to do the procedure but you feel like you can't do it in May, if you'd rather do it in June or July, we'll also honor the 20% discount if you book it in the month of May. So with that, I see that there's a couple of questions here. I'm going to pull these up and address these for you. So a great question here. First person asked, can you get Ultherapy if you've had Botox recently? And I would say there's no hard and fast rule to that. I would say I would probably wait 1 to 2 weeks. And the reason is it takes 1 to 2 weeks for Botox typically to take effect. So at that point, it's unlikely that the Ultherapy would affect the Botox. And here's another question. Someone wants to know, will the treatment work for someone that's losing significant weight? Would you recommend to do this treatment first or lose weight and then do it afterwards? Another really insightful question there. I would probably get close to your goal weight before you do the procedure, because certainly your laxity and volume and anatomy of your face and skin structures could change. So I would probably handle it that way. Next question is, how much does it cost? And that's a great question. It really just depends on how many areas you're doing. I will follow up on that. I'll have our manager, Amanda, or one of our office staff certainly reach out to you all in the next few days and give you specific pricing if you're interested in, like, I only want my jaw done, or I'd like my jaw and neck area done, then we can kind of price that out for you. Another person asked, can this treatment be done on other parts of the body? So I think that they're doing what they would call off-label studies and research on other areas of the body. For example, maybe you have laxity on your arms or on your thighs, but there's been nothing actually approved by the FDA specifically for that at this point. Another person has asked here, the first slide you mentioned that there was an older woman that had several treatments. How many is several? So that particular patient had 2 treatments a few months apart. Along the lines of the Botox, I think another question would be, if you've had filler, can you have Ultherapy? And yes, you can have Ultherapy. I just wouldn't recommend you have it within close proximity. So if you had, for example, filler of your cheeks, I would probably wait a month to make sure that filler settles and there's no residual issues with it. Next question coming up here is, how many treatments do you usually recommend? So that's another great question. Really, again, depends on how much laxity is there and what your goal is. If you're looking to get the maximal improvement, and let's say you're in your 60s, I would probably recommend 2 treatments, about 3 months apart. If you are, let's say, in your 40s and you're noticing just some mild laxity, I think 1 treatment would be sufficient. And along those lines, I've had patients ask me, is this a one-time treatment and then we're done? And the answer is, unfortunately, no, because we all know we can't fight biology. And so that will continue to form the volume loss and skin laxity. So usually what I end up doing is doing it probably once a year on most people. Another patient asked here, is it safe if I have rosacea? I think that's a great question. Rosacea is essentially where your blood vessels in your face are very reactive or sensitive, so you get quite red. I would say it's safe. You certainly could have a little bit of a rosacea flare, which certainly could be treated. We would just have to know how severe your rosacea flare is before counseling you further on that. We'll wait a minute here, see if there's any other questions. These are all great questions. So I will just leave it as, if you guys are further interested and you feel like you have more questions, happy to do a complimentary consultation for you to guide you on your specific questions or concerns. And then if you feel like, you know what, this is something I actually want to do, then we're happy to just proceed with an appointment with that 20% off. And you can call our office at the number on the slide, the 617-3376, or email our appointments at westlakedermatology.com. Thanks so much, everybody, for your time. I hope you got some insight into Ultherapy. I really do think it's a very valuable tool, especially if it's a non-surgical option. I've had plenty of happy patients with it, and would love to hear from you all. Thank you so much for joining us.